This is a public service announcement from Ellsworth County Medical Center. We are in this together, but we all need to do our part in virus prevention. But during these uncertain times, it's easy to make mistakes. Education is the key, so ECMC is here to help you avoid 5 mistakes that could worsen the COVID-19 outbreak. Number 1, not quarantining when you're sick. If you have COVID-19 or suspect that you do, but have mild symptoms, including low fever, cough, or sore throat, you should self-quarantine as the Centers for Disease Control and Prevention, or CDC, recommends. Those with more serious symptoms such as high fever, weakness, lethargy, or shortness of breath should seek medical care. Plus, if you live with other people or even pets, quarantine yourself from these individuals too. The CDC says stay clear of family members, even your animals, when you are symptomatic until more is known about this virus. Sorry, that includes snuggling, petting, being kissed, and sharing your food. If you must interact with your family or your fur kids, wash your hands before and after and wear a mask. It's important to take these quarantines seriously. In normal times, many of us work from home, but it doesn't mean that you're isolated or locked in your house. But in this case, it really does mean that. You're agreeing to stay at home. Keep yourself away from others and prevent spreading this highly contagious illness to your family and the community. Number 2, even though there have been valiant efforts by reputable companies and agencies such as the CDC, social media, television, and even some internet sites have swarmed with conspiracy theories and misinformation. The risk is that some people may believe these stories. For example, that the virus is a hoax or not a serious health threat. Then they may become ill, not quarantine themselves, and spread the virus to many others. A good rule is to be skeptical of those theories, especially those that sprout close to home. For instance, people should not listen to Uncle Harry's idea of what you ought to do, as opposed to what the CDC says you should do. Educate yourself and check out your information from a reputable source. Number 3, seeking alternative treatments. If people are sick but pursue so-called alternative treatments or natural therapies rather than quarantining themselves or seeking scientifically backed medical care, they could pose additional risks to the public, according to the experts at Sanford Medicine. As of yet, there are no vaccines for COVID-19. So beware of claims of cures, including eating garlic, downing elderberry syrup, and guzzling vitamin C, all ideas that have recently been debunked by the Annenberg Public Policy Center at the University of Pennsylvania. Number 4, this may seem obvious, but practicing good hygiene. We know it's been repeated and it can be a chore, but it's important, so we'll repeat it once more. The CDC recommends the following good hygiene practices. Of course, avoiding close contact with people who are sick. Not touching your eyes, nose, and mouth. Staying at home in isolation from friends and family, especially if you become ill with COVID-19 symptoms. Covering your coughs or sneezes with a tissue or your elbow if a tissue is unavailable, then tossing that tissue immediately into the trash. Cleaning and disinfecting frequently touched objects and surfaces using regular household cleaners and wipes. wearing a face mask if you're showing symptoms of COVID-19, or if you're a healthcare worker or caregiver of someone who is sick. Washing your hands with soap and water for at least 20 seconds. A good rule of thumb is to sing happy birthday twice. Or you can use alcohol-based hand sanitizer that has at least 60% alcohol. The last thing to avoid is number 5, stockpiling face masks or respirators. Stores across America have sold out of face masks, and it's getting difficult to buy them online without paying a fortune. The U.S. Surgeon General tweeted on February 29th, "Seriously, people, stop buying masks." Wearing a regular surgical mask does not protect you against coronavirus. That's because these masks only loosely fit over the mouth and nose. They don't protect the eyes at all and don't block tiny viral particles. In contrast, the N95 respirator can offer protection, but the public shouldn't stockpile these either. It's important to realize that these respirators are only worn in healthcare settings. Because of hoarding, medical professionals, people sick with COVID-19, and their caregivers won't have enough access to them. Remembering the 5 things not to do during this COVID-19 outbreak is important. Essentially, it involves restraining how we think and behave. The 5 worst things anyone can do during this COVID-19 outbreak is to not quarantine, believe false conspiracy theories, seek ineffective natural or alternative treatments, not practice CDC's recommended good hygiene practices, or stockpile scarce masks or respirators. We're all in this together, so let's pull together. All in all, the best way to beat the virus is by changing how we as people behave. And as always, we here at ECMC care about you. We strive to support the COVID-19 prevention effort by bringing you accurate and helpful information to help keep you and your family healthy and safe. Please feel free to contact us at any time with questions or concerns.